Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoy today's episode. Hey friend, I hope you're having a great week. I am so excited over here because we are starting the Restore 8-week program with my first beta group. I am so proud of these ladies and just so honored that they trust me in their healing journey. And I'm so excited to see what goals we reach and how far these women grow and create a sustainable lifestyle. This is not just a one and done. We are trying to build and change habits so that you can be the strong, confident, and playful mama that everybody deserves. And so if you didn't get a chance to join my Restore program, don't worry, it's not going anywhere. Send me an email if you're interested in joining, and I will let you know when applications will be open and how you can join in on my Restore program. And so if you missed it, I am launching a new app called Pelvic Floor Core and More, where my Restore program is hosted. Currently, that app is not live in the app stores, and my members are needing to go through this program online and on a web browser. So just a little workaround until we get the app submitted and accepted into the iTunes and Android app stores. So again, stay tuned both here on the podcast. Follow me over on social media, and if you want to be the first to know and get all the details of anything I'm working on and new programs and master classes and exercise programs and routines that will be added to the app, then join my newsletter and become part of my Balanced Mama tribe. The link is in the show notes below, and that will give you all the details for all the fun things that I have coming for you, because this app and this Restore program is just the beginning. But today, I thought it'd be a fun time, since this is week 1 of the Restore program, to give a little breakdown into how you can do your own pelvic floor assessment, because this is something that we need to be able to have an awareness of and keep an idea on. And it's hard because it is an internal space. But so many times I have women coming in and getting that internal assessment and just being mind blown at all of the information that they're given and how thorough the assessment is. Even just today, I had a woman who had been seeing another pelvic floor PT in New Orleans. She saw another one in California, and then she was coming to see me since she moved here to New Mexico. And so I'm always curious when other people have seen other pelvic PTs, how different it is, because we're not all the same. We definitely, just like any other PT or medical doctor or provider, have our own philosophies, our own strategies, how we approach things. And so I'm just always curious how it is everywhere else in the pelvic PT world. And it's just such a great thing to know that overall, I have never had someone be like, oh yeah, it was almost the same, or majority of the time, these women are going, oh my gosh, this was so much more information that I got from my other pelvic PTs. Or, why is my gynecologist not giving me some of this information? And these are both very good questions, because overall, I think every pelvic floor PT should be doing as thorough an assessment as I am doing.
The unfortunate reality is that you go to your gynecologist and you assume that your pap smears or whatever pelvic assessments that they're doing are assessing for things like IM, but they are not at all. So that is the first thing to note, is even though you might have gotten an internal assessment from somebody, it's not all the same. So inside today's episode, I'm going to lay out what I help my patients find, and then also how you can try and find some of that information yourself. Because again, with this Restore online program, being that it is a virtual program, you are obviously not in person. So I cannot do that internal vaginal assessment on you, but it is still crucial information to know. So it is not as thorough or comprehensive as getting it done by a pelvic floor PT. And so it should not take the place of an assessment from a pelvic floor PT, but it can still give us a ton of great information just to give you an idea of where your pelvic floor health is at. Because in the gynecology world, they're looking for more more severe things, right? They're looking for infections. They're looking for fungus, yeast, scarring, abnormal polyps, bleeding. Sometimes they check for prolapse, but they don't always. And so they are looking for big screening things, cancer, obviously, fibroids. They're looking for abnormalities in the tissue. And we need to have that information. But that information tells you absolutely jack shit about how well your pelvic floor actually functions. And this is the thing we all need to know, because again, our pelvic floor is the floor of our core. And if your pelvic floor is not functioning how it should, that means your core is not functioning as it should. And if your core is not functioning as it should, that changes all the pressure in your system. It changes how load and forces are dispersed through all the other joints in the body, your shoulders, your neck, your elbows, your knees, your hips, your feet. Every single joint that comes off of the trunk depends on a nice, stable trunk that can function optimally. And so we see all of those other dysfunctions, again, elbow, anything, any other joint issue could be coming from dysfunction in that core space. And dysfunction in the core space might as well be coming from pelvic floor, because we know it's all connected. And so we need to make sure that whole core system is working together and that you're managing that pressure equally. So we're not only looking at, is it strong? Can you engage it? And that's what everyone thinks I do, right? I just teach kegels, and that is so far from the truth. But we do need to be able to isolate that. And I did give an episode on kegels and how to master those contractions and engagements. So make sure you check that episode out if you're curious. But today I wanted to more give you a sense of, one, why it's important to get that internal assessment, and also how different it can be between providers and definitely between gynecology and pelvic floor PT. We are not looking for the same things, even postpartum, when people go for that quote unquote clearance postpartum. That is a very disfortunate name of that appointment because and they're calling it the postpartum checkup, right? But then they're saying, you're all cleared to go back to activity as usual. And this is usually when women are like, oh, thank God I've missed running, or I've missed exercise, or missed sex, or whatever it is. And they jump right back in. And then we start to see the issues. Maybe they had no leaking, had no prolapse, had no pain, and now they are. So we really want to avoid that and make sure that that pelvic floor is actually functioning and ready to do that effort. And so with that being said, you also don't have to wait till that 6-week checkup to start doing things. This is where a pelvic floor PT can really help guide you in that early postpartum stages where mom is kind of left on their own for 6 weeks. This is a very, very vulnerable time for the pelvic floor because all of those tissues are healing. And if you aren't taking care of your posture and your breathing, and you're bracing and you're not looking at the scar tissue, we can really change that tissue healing for the worse. Or we can optimize that healing and make sure that everything is coming together well. We're not having diastasis show up. We're not having leaking or prolapse. And you can go into sex even with no pain. These are things we can start working on week 1 postpartum. So make sure you have a pelvic PT in your corner, and I am here for you for that. And yes, I have some online prenatal and postpartum birth prep masterclasses that will be added to the app shortly. So again, stay tuned. Lots of more fun things coming out into my app. But for today, let's just dive into what I am looking for in my pelvic floor PT assessment. And hopefully this will give you an idea if you have had a pelvic floor PT assessment, if it was similar. Were you getting all of this information? Did they even tell you any of this information? Because that's the other thing. Maybe they're looking for all of this, but you have zero idea. They're just there, down there, doing their thing, telling you to squeeze, telling you to relax, telling you to breathe, and that's all you know. And that is very unfortunate because I want my patients to leave knowing what is going on, why it is going on, things that they can do to help impact and heal and change everything. And so the very first thing that I look at with a pelvic floor assessment, and yes, this is an internal vaginal assessment is what we are referencing today. And this could be any woman. It doesn't have to be postpartum, but any woman when I'm doing that internal vaginal assessment, we first just start with the breath. 1, to just get the body and the pelvic floor to relax because yes, nobody likes someone's finger in their vagina, especially some random person, right? And so we want to make sure that the body is calm and that breath work really helps to do that. But then I'm also watching because that perineum should move. So we want to see that movement come into the perineum with the breath. I am also palpating down the inner thighs because if there is tension and tightness down those inner thighs, that pulls on the fascia and the attachments of the pelvic floor. And so therefore they can cause tension and dysfunction within each other. A lot of leaking comes from adductor dysfunction and tightness. So we need to make sure that those adductors are not too tight and also functionable. And hopefully you've listened in to enough episodes to know how important it is to have a fully functional pelvic floor. We don't want a super tight pelvic floor and we don't want a super relaxed pelvic floor, right? We need both the ability to contract and relax and use it within all of its ranges of motion. So it's not just as simple as can you turn it on or turn it off. The same thing goes with the adductors, right? We're not just going to think engage and turn it off, turn it on, turn it off. No, but how does it function? How does it move? Can you even widen your legs very far? Does butterfly position hurt? Does sitting cross-legged hurt? We need to start getting into those inner thighs. So I palpate down those inner thighs and then I palpate the superficial of the pelvic floor. So this is where we're looking at more around the vulvar lips, the perineum, right around the anus and in the rectum, inside the sit bones. Just putting pressure here, we can start to identify if there's tenderness or tightness or sensitivity. I'm looking to see if there is any infection or redness or vaginal atrophy. We can definitely get a lot of vaginal atrophy, especially going through menopause, but even sometimes in perimenopause, we can see this. And in postpartum, we don't necessarily see atrophy, but we can see low estrogenized tissue because of that hormonal drop that happens after baby is born. This can be a big cause for irritation, symptoms like prolapse because you're feeling irritated tissue rubbing, maybe intercourse sucks because things are really dry and raw and it's just hurting. This is usually a sign that you are low in estrogen and would really benefit from some topical vaginal estrogen cream. I need to do an episode just on that alone because it is a game changer for postpartum, perimenopause, and menopausal women, okay? So we are looking at tissue health, we are looking at tissue tightness, sensitivity, and then I'm placing my finger, just one finger, at the opening. And we're really looking to see, again, sensitivity, tightness. I'm giving a pressure down on the perineum. How does that feel? And then we're kind of swooping through that lower vaginal opening to see if there's any tension or sensitivity. We're checking side to side. If there was any scar tissues from tearing or an episiotomy, we're checking the mobility of that. And then internally, this is where you're in more of the deep bowl, and I'm checking for strength. Can you contract it? Can you relax it? I'm feeling, where does it start? Is it starting already in a tightened contract place, or is it already drooped and relaxed and not turning on at all. So again, we need to feel, is it even turning on? But then we need to hopefully feel it actually squeeze and lift up through the 5 levels. And I have talked about this 5-level elevator concept before, but we do want to feel different level changes of that pelvic floor. Again, just like the bicep, you're not just going to have it contracted and fully shortened with your elbow bent all the way or fully straight and shut off. There's that range of motion within that elbow and bicep motion. And that's the same thing with the pelvic floor. We want to feel that different ranges of motion. And if you don't, you're probably really tight. So again, that's why the breath is so helpful. We really need to get that breath in there to be able to relax and open things up. So I'm also internally feeling that breath. Do we feel the breath coming into the pelvic bowl? Do we feel that moment that it finally hits those muscles and those muscles stretch and relax out? Or maybe we feel the breath come in and the muscles don't do anything because they're so stiff and tight. So we're checking strength side to side. We're checking, is that breath coming into that space? I'm then looking for motor control. So can you contract and relax? Again, it's just as important to not only be able to contract up to that 5th level, but also to be able to drop it all the way back down to that level 1. So we need to feel that contract, relax. And then we do some repetitive contractions to start to notice if you're someone with more of a hypertonic pelvic floor, meaning there's a little bit more nervous system tension in your pelvic floor just at rest, you might be someone that you start a little high. Maybe you don't even start that high, but when you go to contract, when you relax, you notice it doesn't fully relax. So each contraction, that pelvic floor is just getting higher and higher and tighter and tighter. This is again a sign that Kegels are probably not the best option for you, at least to start. We need to make sure that you can turn that muscle off and drop it all the way back down to that 1st level. And so again, we're checking that fast contraction. Then we're checking that light hold. Can you engage and hold it? How long can you hold it? And then again, does it shut back all the way off or does it stay tight? Then we're looking for pressure management. And remember, pressure management is really that huge goal, because even if you have a strong pelvic floor, if you're not managing your pressure well, which is how you use your whole core system, if that core system is not coordinating together well, you will mismanage that pressure and shove that pressure down onto the pelvic floor. And this is the enemy. This is what causes the leaking. This is what causes the prolapse. This is what causes the hemorrhoids. This is what causes the hernias and the diastasis. So pressure is not what we want. We want that pressure to be equally distributed throughout the core system. And yes, during certain exercises, we might bias the breath and that pressure to go in certain spaces so that we can kind of save our pelvic floor or other parts of our body. But we definitely don't want that pressure going down onto the pelvic floor. So what does this look like? Internally, I am feeling when you go ahead and give me a cough. So this always makes me laugh because it kind of reminds me of when you hear of men going to the doctor and having a doctor grasp their testicles and tell them to cough. They're kind of testing for similar things, but we're really looking to make sure that we are getting some engagement there. There should be some reflexive engagement. When you cough, sneeze, blow your nose, and even throw up, especially prenatally, that first trimester, if you're throwing up a lot, we need to make sure there is support, because if you're not giving that support from the pelvic floor, you're just shoving pressure down over and over again. So we should feel a proactive lift. We call it the neck. It's that proactive engagement, or Kegel. It's the same thing. Contraction, engagement, Kegel, same thing. So we need to get that engagement before a sneeze, before a cough, before you blow your nose, so that it can support those organs when that pressure does come down, because it does increase the pressure. But do you have the support to withhold it? And when we don't have that support, or if we're mismanaging and just increasing too much pressure from above, this is why we see all that dysfunction down below. So this is where the breath comes in, because the breath is really where we get that coordination. But we first just need to start with, do we get that engagement right before those pressure moments? So we're checking that. And then I'm checking for more of that volitional engagement. What does it feel like when you are creating your brace, when you're actively and deciding to engage your brace? What does that feel like? What does it feel like internally? I'm starting to feel if that pelvic pressure and I'm feeling pelvic organs come down? Or do I actually feel a lift from below like I should and feel that abdominal brace kick in like I should? So we get good awareness of how are you bracing, if that bracing is where you're finding issues and it is increasing pressure, or if that actually isn't a huge deal because you're bracing appropriately. So we give you feedback on that. And that is huge because you want to be bracing whenever you are doing anything under effort or load or exercise. And if you're doing it inappropriately or not optimally, and you're actually bearing down into your system, this can be the cause for everything. So just fine tweaking some of these things you're just naturally doing throughout the day can be the game changers. It's not just sitting there and strengthening all day, okay? And I know I say that almost every episode, but it still never fails. Everyone comes to me thinking I just give kegels. So anyways, aside from that volitional bracing and engagement, the other thing I am feeling for that not every pelvic PT is, and this is something you can't check yourself. So this is something only a pelvic floor PT or gynecologist can do, but only pelvic PTs that are specifically trained in this can do it because we're not all trained. But I did go to a training this last year with one of the most world-renowned prolapse specialist, Taryn Hollum. So I am really grateful to have learned from her and do know how to do a prolapse assessment. And so prolapse, again, is when those pelvic organs are coming down out of our body. Big no-no. We obviously don't want our uterus or our bladder or our rectum falling out of our body. And so we want to catch this early, and you can have prolapse without symptoms, but especially if you have symptoms like heaviness, something literally falling in and out of your body, you feel like there's tissue where it shouldn't be, tissue rubbing, feels like you're sitting on a ball of tissue, or maybe you even just see a bulge coming through the vaginal opening. Those are signs and symptoms of prolapse, and I would definitely get in to get a prolapse assessment because we want to get on top of managing that ASAP before it gets worse. So I do screen prolapse and make sure that we're getting on top of that if there is any present, and we are screening all of those organs to make sure we're not missing anything. And then I'm walking around the pelvic floor with my finger, feeling for trigger points, tightness, nerve impingement, sensitivity, maybe dull sensation can also be something I find where people are like, I don't really feel anything internally. Or maybe they even say sex hasn't been as enjoyable. I haven't really felt as much. Orgasm hasn't been as exciting. And this is another big benefit of pelvic floor PT. We can make those orgasms so much better and get rid of the pain, especially if there's pain associated with sex or arousal, or even just with sitting or walking, or you're having any vaginal, pelvic, tailbone, hip, low back, low abdominal pain. This can all be coming from pelvic floor. So again, I'm looking at so many different things and how it holistically, or I should say whole body connects, right? We're looking at that whole body. How does that kinetic chain work together? So yes, we're starting at the pelvic floor, but then we're connecting it to the whole core system. Then we're connecting that whole core system to the rest of the body. And that's something I'm really excited about inside the Restore program because there are a couple weeks where we are diving above the pelvic floor and below the pelvic floor with different exercises, mobility, and manual soft tissue techniques that will help release and balance out and just reconnect and get the whole system working together so we can find that root cause and not just slap a brace on it, slap a pad in your underwear, accept this pain or leaking as life. That is not how it needs to be. And so first thing I want you guys to do, and inside my Restore program, I am giving a pretty thorough self-pelvic floor assessment. So if you want more on that, go ahead and join that Restore program and let me know if you're interested, because I also am giving you feedback on what you find. So you're getting feedback not only on what you find, but more guidance on what you can go looking for, or things you might want to do, or things you might want to stop doing based on what you found. So you will get some assessment guidance off of that self-guided assessment. But for today and for my listeners, I did just want to get you thinking about this pelvic floor assessment and give you some things to start trying so that you can start assessing your own pelvic floor. One of the first things is feel your inner thighs. Like I mentioned, those inner thighs tie into the pelvic bowl. So usually it's very rare that I find inner thighs that are tight where the pelvic floor is not. It usually goes hand in hand. So if you have tightness and knots and trigger points in your inner thighs or your adductors and it's uncomfortable to put pressure or massage them, or you just know that's where your tension is, you might have some pelvic floor tightness. So opening those inner thighs, trying to stretch those open gently and doing different moves to open the inner thighs in itself can really help your pelvic floor. But in terms of your pelvic floor in general, again, reconnect. Can you see the breath? Can you feel the breath? You should feel or see that perineum move away or towards the mirror or towards your hand, right? So that inhale, you should feel and see pressure come into your hand or that perineum move towards the mirror. And on the exhale, it comes back up and into your body. So we just want to see, is that breath even getting there? Maybe you're the opposite. And when you inhale, instead of seeing that pelvic floor bloom or blossom, you're actually seeing it contract and tighten back up. That would be a sign that you're actually really increasing and compressing the pressure in your system, and we need to retrain that ASAP. So just that breath can give you a great insight on if you're getting actual expansion into that pelvic bowl, if you're coordinating that breath with the whole core system well. But then take your hand and feel around the vulva, feel around the rectum. Find those sit bones and stick your fingers inside those sit bones. It's inside the cheeks, and you put your fingers inside those sit bones. Is that tender? Because that's your pelvic floor. If it's tender, start that breath work. And I would also probably get a pelvic wand, and you probably want a pelvic floor assessment by a PT just to get a little bit more guidance, because yes, kegels might not be the answer for you, and even general strengthening, especially glutes, might not be the best thing for you right away. So just feeling can be a great insight as to what's happening at your pelvic floor, especially if you can take your thumb and just place it in that vaginal opening and think about pushing into the perineum. How does that feel? Is it tender? Is it uncomfortable? Go to both sides of that perineum and feel that pressure as well. Is there a difference side to side? If there is, then stay on the side that's a little more tender. Place the pressure that's tolerable and breathe into it and just start opening this space up. The perineum is also a great space to get an idea on what's happening in your internal bowl, because the perineum is where every layer, fascia and muscle of the pelvic floor bind together. So if it's tender and uncomfortable, chances are you also have some tension inside the pelvic bowl somewhere. And so just checking that perineal space, because it is a little bit more external, can be very helpful for you to get an idea on what's going on in the whole space. But then if you have the capacity and if you are agile enough, place your finger in the vaginal opening as far as you can get that finger in without actually crunching and holding abdominal tone. So I think it's great to do this semi-reclined with support so that you're up a little bit, but your abs aren't what's holding you up. I want you to be relaxed, but you do need to have a little leverage to be able to get the finger actually inside of the vaginal opening. But once your finger is there, can you feel a kegel? Do you feel the muscles pinch and squeeze around your finger? You should even feel it lift your finger up and in. So we call it the squeeze and lift. Do you feel the squeeze and do you feel the lift? If you don't feel one of those pieces, we need to work on that, because that could be that it's one of the layers. Maybe your superficial layer isn't working, maybe your deep layer isn't working, or maybe they're just both really weak, or maybe they're both really tight, and that's why you're not feeling any movement through them. So just feel if you can even feel a squeeze. But then when you relax, just as importantly, again, notice, does that squeeze fully shut off and go away, and you lower that finger, lowers all the way back down where it was? Or do you notice there's still a little tightness around your finger when you try and relax? Or maybe your finger didn't drop all the way down like it was before. That would again indicate some tightness in the pelvic floor. So those assessment pieces can in itself be a game changer for you, because if you can find that tightness and tension and signs of pain and asymmetries before you actually have symptoms, that's the best thing. That's proactive medicine. That is being preventive, and we can stop issues before they even show up. But if you know you have leaking or pain or prolapse or some of these other obvious pelvic floor dysfunction symptoms, then I want you to really start assessing and keep an eye on that tissue. How does it feel? How does it move? How does it lift and engage? And we should not feel or see any other muscles engaging with that pelvic floor except your lower abs. So if your lower abs tense at the same time your pelvic floor lifts, that is okay. But if you see your inner thighs come together, if you see your glutes squeeze or anything else, that's a no-no. We do want to isolate the movement at the pelvic floor. Use mirrors, use hands, use those eyes. All of these things help the brain reconnect and rewire and just learn what is going on at our bodies. This doesn't need to be a taboo space. We don't have to wait for some random provider to see us once a year to tell us what's going on in our own bodies. I self-assess my pelvic floor almost every time I'm in the shower. I'm like, what's going on? Is it moving today? Is it tight today? Can I get the breath in there? Is it equal? And this does get very nuanced at this point. I can tell myself, oh, my breath is going more vaginally than rectally today. So I think I'm having more rectal tightness. So now I'm going to work more on getting my breath more into my rectum, and I'm going to focus more on engaging more in the front. We can isolate different parts of our pelvic floor, and this is important. But the first step is just to assess and get a ground level of where your pelvic floor is at right now. And if you had any of those issues or symptoms, then reach out and let's definitely put you on that wait list for a coaching call or the Restore program so that you don't have to wait and live with those symptoms once they show up. And if you do have symptoms, let's get on top of them ASAP before they get worse. So I hope you found this episode helpful and give you some ideas of how you could go start and assess your own pelvic floor today and get a better awareness of where you are at and how much work you need, and if you should start with strengthening or breath work and releasing. So such good information. I think everybody needs to know this stuff. So I hope this inspired you to go assess your pelvic floor, and I would love to know how it went, or if you need any other tips or advice, make sure to reach out into my information in the show notes below, or go over and join the Balanced Momtality Wellness and Support, which is a free and private Facebook group where you can ask questions, get more guidance and support, and just be there to cheer each other on. So go have a great rest of your day, lady, and we will see you here next week at the Balanced Momtality Podcast.
Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality Wellness and Support. I hope to see you here next time on the Balanced Momtality Podcast.